Thank you very much. Hello, everyone. It's a great pleasure to be here. Thank you for the kind invitation. I try to share my screen. Let's see.
This is the first test.
Yes. Oh.
Congrats.
Is working?
That looks great.
Okay. So it's on the role of EMSOS in Europe. And let's go back about 50 years to 1987. And at this time, quite also important for EMSOS, the ENF treaty was signed. By on the right hand, you see Ronald Reagan. On the left hand side, you see Mikhail Gorbachev. And this was the first time that the superpowers had agreed to reduce their nuclear arsenals.
Andreas, if I could just step in briefly, I think we're still stuck on your opening slide. Oh, that's moved through now.
No, wait. Then maybe I'll do it otherwise.
Yeah, have another go.
So, is it better now?
That's perfect. Yes, that's ideal. Excellent.
Sorry.
Do go ahead. No, thank you.
Thank you. So it's Ronald Reagan on the right side and Mikhail Gorbachev on the left side, and they signed this Intermediate Range Nuclear Forces ENF treaty. And in the same year, 1987, in this 500 years old Venetian villa in Treviso, in Italy, 19 sarcoma experts met. You can see there is, for example, Mario Campanacci, a quite famous pathologist and also orthopedic surgeon from Bologna in Italy. But you can also see here it's Stanley Matejowski. He was an orthopedic surgeon from Prague. And at this time, you see there was still the Iron Curtain between the Eastern Bloc and the Western Bloc. And Prague, of course, was in the Eastern Bloc, so it was quite not normal that it was easy to travel between those two blocks. And for the aims of EMSOS, the aims of the European Musculo-Skeletal Oncology Society are to advance the science and practice of the diagnosis and treatment of bone soft tissue tumors, and to promote basic clinical research and to disseminate knowledge in order to provide a common high standard of musculoskeletal oncology. And in particular, the particular purpose of the association is to promote mutual collaboration between different specialists and institutes involved in the treatment of those horrible tumors. And the first meeting was organized by Professor Kotz in 1988 in the, let's say, neutral zone between the Eastern Bloc and the Western Bloc, and this was Vienna at this time. Later on, we went to Stockholm, we went to Bologna, to Birmingham, to Prague, to Pamplona, to Paris, Istanbul, Florence, and so on. So nearly all major European countries have been visited by EMSOS. And you can see here there's a lot of discussion going on. You can see here Pancras Hogendorn, a very famous pathologist. Rob Grimer, I think you'll all know his golf ball. Here you can see Jeremy Whelan, Sanne Dijkstra, and Michael van der Sande from the Netherlands. Here you can see Stefan Bilak. So really nice discussion going on at these conferences, but also some nice eating programs. And we also had at some conferences with patients stay, like Professor Bilak organized one in Stuttgart. We also had sometimes combined meetings with the Americans, for example, in Boston or in Massachusetts, in Boston and Washington. And we also went to the Eastern Bloc, like here in Moscow, but we also went to Warsaw, to Budapest, and to Prague. And this year, if you're interested, please come to visit us in Graz, in Austria, maybe with snow, and we'll have a big meeting here if Corona allows. At the moment, we have 226 members from 41 countries, many European countries, but also some from the US and Argentina, Australia. And you can see here a map with most of those centers. And you can see the people involved of each center. You can see a concentration around Northern Italy, also Switzerland, Austria, Germany, and the UK. But also you can see 8 people from Kiev and 2 from Moscow, and also from the northern countries, and also some people from Turkey and from Israel. The members are mainly orthopedic surgeons, but we also have a lot of oncologists, and also some pathologists and some radiotherapists. This year, a course was again planned, and these courses have been introduced by Miklos Shendroy from Budapest. And it was a basic instructional course, mainly focused for young specialists or young doctors to just have good information on how to treat those sarcomas, how to diagnose bone and soft tissue sarcomas. These courses were then taken over by Professor Ruggieri from Padua, and they went on a yearly basis before COVID, went to Venice and to Padua. But he also went to Bosnia, for example. Here you can see Sarajevo, and also tried to educate and discuss cases with the people there. We have a traveling fellowship each year, and you can see here those people, those young residents should go to 2 to 3 different centers in Europe and just see how things are done there and how to better treat sarcoma patients at home. One of the most important things besides the conference is also publications. You can see here in 2020 we had 5 publications on different topics, like adamantinomas, a very rare bone tumor type, an angiosarcoma of bone, again a very rare tumor type, but also on the impact of COVID-19 on patients with musculoskeletal tumors, and also on organization of bone sarcoma care. And this year already from an Italian group, again, multi-center study has been published on extra-abdominal desmoid tumors. I think it's also very important, and the conclusion here, which is also quite important, but not for the bone sarcoma track, but for the desmoid room, it's more wait and see than doing big operations. A lot of studies are still going on, organized by EMSOS, and one of those guys is also in the conference room today. It's Demosthenes Andrea from Berlin, and he's also doing 2 studies. So I think it's very important, especially for those extremely rare bone and soft tissue tumors, to combine cases and then to discuss how should those patients be treated properly. What's the best way? Is it a big operation, or is it more small operations and radiotherapy, or even targeted therapy? We tried to involve nurses and other personnel from the very beginning, study nurses, study coordinators, nurses, psychologists, physiotherapists, and I think this is quite important. And let's go back to this Eastern-Western bloc thing. You can see here quite a famous recent publication from 2018, where you can see here the age-standardized 5-year relative survival. That means how high is the percentage of patients surviving horrible bone or cartilage sarcoma. And you can see here there's a big difference between the Western bloc, let's say Western bloc, and the Eastern bloc. We have very good results in Northern Europe, good results in Ireland, UK, very good results again in Central Europe, standard results I would say in Southern Europe, but horrible results with only about 40% of bone sarcoma patients surviving 5 years, and it's really horrible. And if you look here again, this is another graph, but with the same data, you can see there's a big difference between the Eastern countries and the Western countries, or Central Europe countries. And it went down after the fall of the Eastern Bloc, and it's going up again, but there's a big difference to the rest of Europe. It's a little bit better in soft tissue sarcoma, but mainly I think because surgery is quite okay in those countries, but they might have problems, especially with chemotherapy or radiotherapy. But again, here there's a statistical significant difference. So the take-home message from my side is I think EMSOS is quite important for conferences, but I think we should do more patients days, especially with groups like SPAEN or other local groups. We need those instructional courses. They're very important. I think it's very important to involve nurses in other professions. The traveling fellowship has been really successful. It was introduced by Rob Reimer, and joint publications I think is also very important to enhance our knowledge on those extremely rare tumors.